When most seniors think about heart health, they focus on what foods to avoid: less salt, less sugar, fewer processed items. But what you drink can be just as important as what you eat when it comes to supporting your cardiovascular system after 60. Certain beverages contain powerful compounds that can help reduce blood pressure, improve circulation, decrease inflammation, and even help repair damage to blood vessel walls. The right drinks don't just hydrate, they actively protect your heart. Making strategic choices about your daily beverages can be one of the simplest yet most effective ways to support heart health as you age. There's no meal preparation required, no complex recipes to follow, just simple swaps that can make a significant difference. In this video, I'll share the top 5 science-backed beverages that directly support heart health for seniors. Hibiscus tea. When it comes to natural beverages that can actually lower blood pressure, hibiscus tea stands in a category of its own. This vibrant, ruby red tea contains powerful bioactive compounds that work similarly to common blood pressure medications, but without the side effects. Multiple clinical studies have found that regularly consuming hibiscus tea can significantly reduce both systolic and diastolic blood pressure in people with mild to moderate hypertension. One study published in the Journal of Nutrition showed that drinking just 3 cups daily for 6 weeks lowered systolic blood pressure by an average of 7 points, comparable to some prescription medications. What makes hibiscus so effective? It contains anthocyanins and other antioxidants that help blood vessels relax and dilate, improving blood flow throughout the body. These compounds also have mild diuretic properties, helping reduce fluid retention that can contribute to higher blood pressure. For maximum benefit, steep dried hibiscus flowers or tea bags in hot water for 5 to 10 minutes to fully extract the beneficial compounds. Aim for 2 to 3 cups daily, ideally between meals for optimal absorption. One caution: hibiscus can interact with certain medications, including some blood pressure drugs and diuretics. If you're taking prescribed medications, check with your healthcare provider before making hibiscus tea a regular part of your routine. Pomegranate juice. While many fruit juices are too high in sugar to be heart healthy, pomegranate juice stands as a remarkable exception. This rich, ruby-colored beverage offers significant cardiovascular benefits that make it worth including in your heart-healthy diet despite its natural sugar content. What sets pomegranate juice apart is its exceptionally high level of polyphenols, particularly punicolagens, which give it 3 times the antioxidant activity of red wine or green tea. These potent compounds help protect the inner lining of blood vessels from damage, while reducing inflammation throughout the cardiovascular system. Clinical research published in the American Journal of Cardiology found that drinking just 2 ounces of pomegranate juice daily for 1 year actually reversed carotid artery narrowing by up to 29% in patients with severe atherosclerosis. This suggests pomegranate juice doesn't just prevent further damage, it may actually help repair existing arterial damage. Pomegranate juice also helps keep LDL cholesterol from becoming oxidized, a critical step in the formation of arterial plaque. Additionally, studies have shown it can reduce systolic blood pressure by 5 to 12% when consumed regularly. To incorporate pomegranate juice into your routine, look for 100% pure varieties without added sugar. Because of its natural sugar content, limit consumption to 4 to 8 ounces daily, and consider diluting it with sparkling water for a refreshing drink with less sugar impact. Green tea. Green tea has been consumed for thousands of years, but only recently have scientists fully understood why it's so beneficial for the aging cardiovascular system. This gentle beverage offers multiple layers of protection for your heart that become increasingly valuable after age 60. The secret behind green tea's heart benefits lies in its rich content of catechins, particularly epigallocatechin gallate, EGCG, which are powerful antioxidants that help prevent cell damage throughout the cardiovascular system. These compounds improve the function of endothelial cells that line your blood vessels, helping them dilate properly and maintain healthy blood flow. A comprehensive review in the European Journal of Clinical Nutrition found that regular green tea consumption was associated with significantly lower blood pressure, reduced LDL cholesterol, and higher HDL, good cholesterol. Even more impressive, a Japanese study following over 40,000 adults found that those who drank 5 or more cups of green tea daily had a 26% lower risk of death from heart attack or stroke compared to those who rarely drank it. For seniors specifically, green tea offers additional benefits through a compound called L-theanine, which promotes relaxation without drowsiness. This mild stress-reducing effect indirectly supports heart health by helping moderate the body's stress response. Green tea also helps regulate blood glucose levels, making it particularly valuable for seniors with diabetes or prediabetes, conditions that significantly increase cardiovascular risk. For maximum heart benefits, aim for 3 to 5 cups of green tea daily. If you're sensitive to caffeine, decaffeinated green tea still provides many of the same heart-protective antioxidants. Beetroot juice. When it comes to improving circulation and lowering blood pressure, naturally, beetroot juice stands in a class of its own. This vibrant ruby liquid may not be on most seniors' radar, but its benefits for cardiovascular health are significant. The secret to beetroot juice's remarkable effects lies in its naturally high concentration of dietary nitrates. When you consume these compounds, your body converts them to nitric oxide, a molecule that helps blood vessels dilate and improves blood flow. As we age, our natural nitric oxide production declines, making dietary sources increasingly important for maintaining healthy circulation. Research published in the journal Hypertension found that drinking just 8 ounces of beetroot juice daily reduced systolic blood pressure by an average of 8 points within hours, with effects lasting up to 24 hours. For seniors with hypertension, this reduction is comparable to what's achieved with some blood pressure medications, but through a completely natural mechanism. Beyond blood pressure benefits, the improved nitric oxide production from beetroot juice appears to enhance exercise performance and reduce fatigue during physical activity, particularly valuable for seniors with heart failure or angina who experience breathing difficulties with exertion. Beetroot juice also contains potent antioxidants called betalains that help reduce inflammation and oxidative stress throughout the cardiovascular system. These compounds may help prevent the oxidation of LDL cholesterol, a key step in plaque development. The most practical way to incorporate beetroot juice is to start with 4 ounces daily, mixed with a small amount of apple juice if the earthy flavor is too intense. Gradually increase to 8 ounces daily for maximum benefits. Tart cherry juice. While not as well known for heart health as some other beverages, tart cherry juice deserves special recognition for its unique cardiovascular benefits, particularly for seniors dealing with multiple health concerns simultaneously. What makes tart cherry juice, especially from Montmorency cherries, so valuable is its exceptional content of anthocyanins and other phenolic compounds that directly target several risk factors for heart disease. These potent antioxidants help reduce inflammation throughout the cardiovascular system and appear to help repair damaged tissues, including blood vessel walls. Research published in the American Journal of Clinical Nutrition demonstrated that drinking 8 ounces of tart cherry juice daily for 12 weeks reduced several markers of inflammation associated with heart disease. Participants also showed significantly lower levels of LDL cholesterol and systolic blood pressure, 2 primary risk factors for heart events in seniors. For older adults with arthritis or gout alongside heart concerns, tart cherry juice offers a valuable 2-for-1 benefit. The same anti-inflammatory compounds that support cardiovascular health also help reduce joint pain and uric acid levels. Tart cherry juice also contains natural melatonin, which helps regulate sleep cycles, particularly important since poor sleep quality is increasingly recognized as an independent risk factor for heart disease. To incorporate tart cherry juice into your heart-healthy routine, look for unsweetened 100% tart cherry juice, not cocktail varieties with added sugar. Because even natural tart cherry juice contains fruit sugars. Limit consumption to 4 to 8 ounces daily. There you have it, 5 powerful beverages that can actively support your heart health after 60. What makes these drinks particularly valuable is their simplicity. No special preparation or exotic ingredients required, just straightforward options you can easily incorporate into your daily routine. Remember, consistency is key with these heart-supporting beverages. Their benefits come from regular consumption over time, not occasional use. Consider rotating through different options throughout the week to maximize the variety of beneficial compounds you're giving your cardiovascular system. Of course, these beverages work best as part of a comprehensive approach to heart health that includes regular physical activity, stress management, and an overall nutrient-rich diet. They're powerful tools, but most effective when they complement other heart-healthy habits. Which of these heart-supporting beverages will you try first? Let us know in the comments below, and don't forget to download our free guide with simple recipes combining these beneficial drinks with heart-healthy foods for maximum benefit. Until next time, here's to your heart health, one delicious, beneficial sip at a time.